This is part 2 in the 3-part series of videos to help you implement the most important systems in your dental practice. In part 1, we started the discussion of implementing systems by following something called the patient journey. We talked about systems like following up on your new patient leads, handling new patient phone calls, insurance verification, check-in and registration for existing patients as well as new patients, exam and treatment planning, as well as financial presentation. If you have not seen part 1, I strongly recommend you start there and then come back to this video. So let's continue where we left off in part 1. You've gone over the finances with the patient. The patient now understands the cost of all the treatment that you recommended them. If they have insurance, they understand what their approximate insurance coverage is going to be, and they're aware of all the payment options, etc. So now for their first appointment back, you plan on doing, let's say, a crown on number 3 and a small buccal composite on tooth number 4. And you've planned about an hour and 15 minutes for this appointment. So now your assistant is on the computer behind the patient, is looking for an open spot on the schedule that is at least an hour and 15 minutes long. But the patient tells you, hey, I'm available next week, Monday morning at 9 a.m. But that open spot is only 45 minutes long. So the assistant tells the patient that, well, unfortunately that won't work because the only available spot that we have open is in 2 weeks. The patient responds by saying, well, I'm actually going on vacation that week, so I won't be available. So now the patient does not schedule any appointment because they don't know their schedule that far out. And you're left with a 45-minute open spot on a Monday morning that could have been easily filled if you had a proper system in place. Sometimes what happens is you go to schedule the patient's appointment and they tell you, well, I've got to check with my spouse, or I've got to check my work schedule because I don't get my work schedule until next week. And the patient walks out of your practice without scheduling any appointments. How often does this happen? Every single day. To prevent this from happening and to minimize the holes in your schedule, you need a system for scheduling appointments. When it comes to scheduling appointments, I follow one simple rule in my practice, is that every patient should have their next appointment scheduled, whether it's for work that you've treatment planned or for recall, or both. There is an exception to this rule, however, especially if a patient has a tendency to cancel last minute and they're doing this multiple times. But if the patient needs work, the goal is to bring them back as soon as possible. So one of the things you need to think about when you're creating a process or a system for scheduling appointments in your practice is, does everyone in your office who is responsible for answering phones or scheduling appointments know how to look up what the patient is supposed to come back for or how long that appointment is supposed to be? In my practice, all the work appointments are scheduled right in the operatory. And this is to prevent bottleneck at the front, especially if you've got only one front desk. Again, this is what I do in my practice, and you have to see if it works for yours. The other reason why I do this is to make sure that I bring this patient back as soon as possible to get the work started. Let me explain. For example, if I usually schedule an hour for a crown, but there isn't an open slot for an hour for at least next 3 weeks, but I know I can squeeze that patient into a 45-minute block, which I do have an opening for next week, because I know the patient coming in right after that usually comes in late. And sometimes the opposite can happen. The front desk will also schedule work appointments for patients, for example, who are calling into the office. So now, for instance, they'll schedule a patient for post-core and crown into a 45-minute block. But I know I need more time with that patient because 1, they take frequent breaks, and 2nd, they have a strong gag reflex. So now I'm working on that patient. It's taken me over an hour to finish what I'm doing, and the patient coming in right after is already here, has been waiting for 15 minutes already. These things will happen. It's not the end of the world. No matter how much you plan, you will deal with it at the time it happens. But one of the things we do in my practice to minimize these kind of things from occurring is use Open Dental's built-in planned appointments feature. Every patient who has a treatment plan in place will have at least one planned appointment created. This way, anyone in the practice can pull up the patient's chart on the computer, look at the planned appointments, and know exactly what that patient is supposed to come back for and how long that appointment is supposed to be. I'll even leave special notes in the note section of the appointment, like for instance, do not side book, or do not squeeze, need the full hour, or pending endo completion with the endodontist, etc. Another thing you need to think about when you're developing a system for scheduling appointments in your practice is, how do you communicate to the front what was done during the appointment and what is to be done next. What if the patient was scheduled for a certain procedure, for example, a crown, and while you're working on the patient, you realize the patient needs endo, and now you do the endo, you do the build up, you even start the crown lengthening. You need a way to communicate these changes to the front desk so they can actually attach the correct procedure to the appointment so it reflects the correct amount of production. And most importantly, when the patient is checking out, the front desk can collect the right amount of copay from the patient. Normally, routing slips are used to communicate appointment information to the front desk. You can tell your front desk what you did during the appointment, what they need to come back for, and how long that appointment needs to be. When I was an associate, I remember filling out these routing slips and I would check off what I did during the appointment and what I need to bring the patient back for. I do not use paper routing slips in my practice. We actually use Teamio's Practice Pulse, which is a digital route slip which is made specifically for Open Dental. Practice Pulse gives the entire office team a visual of where the patient is in and allows anyone to ping any team member. Everyone in the office can see who's arrived and is in the check-in area, how long they've been waiting for. With real-time seamless integration with Open Dental, when your front desk updates the appointment confirmation status to ready, for example, everyone in the office can see the patient is ready to be brought back to the operatory to start treatment. The assistant then moves or drags the patient over to the right operatory in the office so the provider can start treatment. Once I'm done with the patient, while they're still in the operatory, I simply click checkout and provide any notes from my front desk. And once I save the notes, it will move the patient automatically to checkout area. And at this point, my assistant usually brings the patient to the front, and my front desk can review the notes I've typed, review any unscheduled treatment, look at what was done by the provider in the operatory, and what the patient out of pocket is going to be. Practice Pulse has been amazing in streamlining our communication and the workflow between the front office and the clinical area of the office. Another important aspect of having a scheduling system in a practice is to schedule appointments to meet production goals. Whether you're a single or multiple provider practice, you need a way to set and track production goals. Whoever is responsible for the schedule in your practice should have a way to see at any given point in time what the scheduled goal is for a particular day and whether or not the office is scheduled to that goal. This should become a daily routine for a scheduling coordinator where a quick visual will show them whether a specific day or certain providers are short of the scheduled goal, so they can actually focus on scheduling for that specific day and or the providers. Another system that offices utilize when it comes to scheduling appointments is something called block scheduling. In block scheduling, you're setting aside a certain amount of time blocks, which may be categorized by either specific procedures or some amount of production. So some of these blocks may be categorized by high or low production or specific procedures. For example, on a Wednesday from 8 to 10 a.m., you may be blocking those 2 hours for crowns. And then from 10 to 12 p.m., you may be blocking it for basic restorative procedures like fillings. When block scheduling is utilized, mornings are usually kept for higher productive procedures like crown, bridge, implants, etc. One reason is because it gives you a good start of the day, and depending on how much is scheduled, sometimes you can knock out an entire day's production even before lunch. The second reason is because the higher productive procedures that require more of our focus are better performed when our energy level is the highest. In my office, I don't do block scheduling because I feel like it has limitations when communicating the value of it to my front desk who's responsible for the scheduling. Let me explain. Think of block scheduling as an outline around your schedule for certain procedures. Let's assume I have a time block of 1 hour in the mornings for crowns, and I have 2 openings next week on 2 separate days for crowns. But today, 2 new patients call the practice, and they're not given an appointment until 2 weeks out because there's no openings next week. Now there's only 1 more day left for the week that we're in the office for to fill these 2 spots that are open for crowns. Now it's the end of the week, in the evening on Friday, and now we have a Monday morning that's completely open from 9 a.m. to 10 a.m. with 0 production because there's no crown scheduled. The front desk is not to be blamed for this because it's a hard decision for them to make whether or not they should have put that new patient in the Monday 9 a.m. block for the crown or wait for an emergency walk-in who may end up needing a crown. The potential of holes is a lot higher with block scheduling. For it to work effectively for a productive schedule, you need an experienced scheduler who has worked with the provider or the providers in the practice for some time. Because it's going to require the scheduler to take the decision into their own hands many times, that team member must know and understand the patient base of the practice and must also understand the provider's working habits and their goals. And this can only happen when that specific team member has been in the practice for a while. All right, let's keep going. Another important aspect of scheduling is to have a system in place for appointment reminders and confirmations. This is a must-have in your practice for today's patients. When you're implementing something like this, you just need to think about how often you want your patients to receive text and or email messages from you for reminders as well as confirmations. I'll just tell you what I do in my practice. 2 weeks before this scheduled patient's appointment, they're going to receive a confirmation message to which they can reply yes or no. If they reply with a yes, it automatically confirms their appointment with an open dental. If the appointment is not confirmed, 10 days before the appointment, they're going to receive another confirmation message to which they can also respond with a yes or no. Regardless of whether they respond to these confirmation messages, they're always going to receive a text and an email for an appointment reminder 3 days and 1 day before their appointment. Don't overthink this and just stick to a routine that works for your practice. You're going to have patients that tell you, oh yes, I've received like 10 emails and text messages from you. And you also have patients that still forget after getting all these messages. So it doesn't matter. Just do what works for your practice and change it along the way if you need to. Even with confirmations and reminder messages, you're still going to have patients that simply forget about their appointments or just not show up. Just the reality of how it is. And this is why you need a system in place for dealing with broken appointments and cancellations. The only thing we can do is track the patients who are doing this routinely and stop giving them appointments. You should also be charging for missed appointments. In my practice, I do this on a case-by-case basis. We do not charge every patient who breaks or cancels the appointment. If a patient happens to cancel their appointment without advance notice, but they have a genuine reason for doing so, we may waive the fee. But there are patients who do this routinely and they're doing this for second and third time. We may charge them anywhere ranging from $50 to $100. There are some patients, if they do it more than twice, we may make it impossible for them to schedule an appointment with us. We don't send a patient dismissal letter. Honestly, it's too much work and too much of a headache on our end. Instead, when they call, we just tell them that we don't have anything open for like 2 months, or we don't have the time slot available when they want to come in. And you'll find that over time, they just take themselves out of the practice by finding somebody else. It's a win-win. The most important thing you can do in your practice for broken or canceled appointments is 1, track who's breaking the appointment and how often. Your practice management should have a way to insert a code to track missed or canceled appointment. This is so you can differentiate who's actually a no-show or who cancels without advance notice. Number 2, pull up a report every week or every month. I do this every month to see how many broken or canceled appointments you've had, who's breaking them, and most importantly, the lost revenue or lost net production from that broken or canceled appointment. This is really for you to review with your team. For me, I utilize Teamio's broken appointment functionality to track this information. Number 3, for the patients who you care to bring back on the schedule, have a way for your team to put that patient on a follow-up cycle so they can bring them back ASAP. These are your patients who genuinely couldn't make it last minute but have a big production in their treatment plan. What I do is on Teamio, either from the main unscheduled treatment page or from the broken appointment list page, I can just select the patient and put them into a follow-up cycle. So then my team can follow up consistently until the patient is back on the books. Okay, moving on. Let's talk about collections. When we're thinking about putting in a system for collections, I like to break it down into accounts receivable and financial policy and payment options. And then I like to break down the accounts receivable further into outstanding claims and patient balances. Each one of these is going to become a process or a system on its own. You're going to have a process or a system in place for dealing with outstanding claims. How often are you checking for outstanding claims? What is your exact process for your team when they're following up on outstanding claims? If a claim payment comes in short, leaving the patient account with a balance, what's your process for collecting patient payments? How often are you checking for patient balances? What is your process for collecting payments from patients who have a balance that's past 45 days, 90 days? Are you sending patients to collections? When do you send patients to collections? All of these are things you need to think about when you're writing out your processes so you can hold your team accountable and make sure they're consistent with their routines. And you're doing all of these things for one single goal, to keep your AR or accounts receivable, which is money owed to you, under control, with an ultimate goal of keeping your collections as close as possible to the net production. Okay, Let's move on to financial policy and payment options. Having a financial policy and protocols in place for your practice is going to allow your team to be consistent for collecting payments from patients. When you're writing out a policy or protocols for your practice, you're going to have to think about things like, for patients with, for example, insurance, when do you collect copays? At the time of service or after you receive the claim and then you bill the patient for the rest of the balance? What happens when a patient has dual coverage, meaning they're covered by more than one insurance plan? What kind of policy do you have in place for collecting copays from patients who have more than one plan? What about for patients whose insurance becomes inactive in middle of their treatment plan? Payment options refers to all the options for financing the dental care that you recommended. And by payment options, I mean patients can pay via cash, check, credit card, third-party financing, in-house financing, etc. What about offering prepayment discounts? Instead of getting into all the details here, I actually have a separate video on financial policy and payment options that I think will be super helpful when you're working through the system. All right, moving on to the next important system, the recall or patient retention system. This is an important and critical component of your practice that's going to keep you, the doctor, and the hygienist busy in your practice. The hygiene production can account for 1/3 of the total practice production and even more, depending on how large your hygiene base is. So what are all the things that you need to consider when putting in a proper system for patient retention in your practice? Keep in mind that each one of these will become a process or a system on its own. How do you keep a productive hygiene schedule, whether it's with the hygienist or the doctors who may be doing their own hygiene? A productive hygiene schedule involves pre-appointing or pre-scheduling the patients for their next recall visit while they're in the office today. So what does your process look like for that? Do you pre-appoint all patients? How does your team handle overdue recall patients? Are you just relying on the automated texting or emails that go out to patients who may have not been in 12 months or more? Do you have a system in place for following up with phone calls for patients who are overdue for recall? How do you get organized so everyone knows who to call when they were called and when to call back again? Is your team even consistent with follow-ups, or is this something they're only doing when the schedule is slow? How are you even making sure the calls are being done? The recall visit. What actually happens during a recall visit? How often are you taking x-rays? What about fluoride application for your patients? Do you have a system or process in place for offering fluoride to your adult patients? And when should it be offered to the adult patients? What about periodontal treatment? Do you have a system in place for your hygienists and or the providers, the doctors, so they know when to recommend periodontal treatment to the patients? Perio maintenance versus prophy. This is a big one with patients. Unfortunately, no matter how much you educate the patients on the difference between perio maintenance and prophy, they forget and they are surprised when they see that they have a copay during their perio maintenance visits. Is your team, the clinical and the administrative team, trained to explain to patients the difference between the two? How long of an appointment should your recall visits be? What's your process for perio maintenance versus a prophy visit? How often should charting be done on patients? Again, my goal with bringing all this up so you can think about how it can work in your practice. If you take any of these points, turn it into flowcharts, checklist, video, whatever form you think will help your team understand the process that you'd like to implement, and then you can tweak it over time as you grow your practice, add more procedures, etc. It's best if you involve your team members who are going to be responsible for performing the task that's laid out in the process. If they're engaged in the creation of the SOPs, there's more chance they'll follow through and actually stay consistent with the process. Okay, remember, all the systems I've discussed in part 1 and in this video, you can break them down further into whatever you think works best for your practice. For the next video, which will be part 3 in this series, we're gonna put everything together by taking an example system, turn it into a process, and then show you how you can take a process and turn it into one or more SOP documents. We'll also go over the tools you can use to create and store these documents so your team can easily access them. We'll go over how to create accountability for your team and by setting up routines for them, because without accountability, your systems are useless. And that's it for today, guys. I hope this was helpful. Keep tuning in and we'll see you next time.